Very good. Just introduce myself. My name is Ray Muirhead, and I am the mayor of the town of Carberry. I'm joined by my colleague on my left, Mike Sudak. He's town councillor, as well as Loretta Oliver on my right, retired nurse, member of the Health Action Committee, and a strong voice for Carberry's health care. We are here happy to host Premier Kinew, Minister Uzoma Asagwara, Minister Glenn Simar, as well as other dignitaries and physician guests who are all surrounding me. Together we are standing on the original lands of the Anish, Innu, Iwik, the Cree, the Dene, the Dakota, the Red River Métis, the Inuit, and the Anishinaabe nations, all of who have paved the way it is now known as Manitoba, home to all treaty people. I just want to say a couple of words on my behalf. I just want to acknowledge Carberry is full of good people who work hard and look out for each other, and healthcare is the utmost importance to all of us, which is evident by the turnout today. Thank you. We, the members of the Carberry North Cypress Langford Health Action Committee, have been working very hard on this task, and we are happy to be here with you today, announcing hopefully some very good news for the town. I take this opportunity to personally thank two important people that have assisted our efforts in the last few months, namely Dr. Dave Maharaj and also Raina Loxley from the Health Minister's Office. Our community is very grateful for your time, hard work, and dedication to today's goal, and we are very thankful for you both. I will start by inviting Premier Kinew to share some news with the residents of the town of Carberry.
Very good. Thanks, Mr. Mayor. Thank you, Mr. Mayor. I got a whole bunch of notes here, but I'm just going to cut to the chase. We're here to announce the reopening of the Carberry Emergency Department. So I'm very happy to be here. Such a beautiful day in such a beautiful community. And we're here to make good on a promise that we've made. Promise to Carberry, but a promise also to many communities across rural Manitoba. It was just about a year ago, we were in Virden, and we stood with members of that community as well as people from across the region, I would say. Mike was actually with us on that day. And we've been hearing so much over these past few years about the stress and anxiety that so many communities across Manitoba have about losing healthcare services. And so we went to Virden on that day to commit that our government, our team, our health minister, Minister Simard, everybody else that we work with at the legislature, we're not interested in closing healthcare facilities. We want to open healthcare facilities. We want to recruit doctors and nurses and healthcare professionals and healthcare aides to work in communities like this one. And so we made that commitment as a general, broad province-wide commitment in that announcement that we did in Virden. And then as the year went on, we just couldn't believe it when the emergency department here was allowed to close. It was a decision that just didn't make any sense to us. Coming as it did basically as we were leading up to Election Day in Manitoba. We figured at least try to keep the facility open until the election happens, and then we can have a chance to sort things out from there. So I made it a specific point to visit Mayor Muirhead during the campaign and hand deliver a letter that I signed in front of him saying that we would ensure that there's a doctor coming back to Carberry and that we'd reopen the emergency department. So we're making good on that commitment. But I want to tell you how much I've learned since that day last early fall, late summer, when I made that commitment. How little did I know of the challenge that communities like yours face when it comes to healthcare. At that time, I signed the letter and I figured, oh yeah, we'll go win the election, make a few phone calls, and boom, we'll have a doctor in Carberry just like that. And on January 1st of this year, the very first meeting that I had in my capacity as Premier in the year 2024 was with Mayor Muirhead, some of our other municipal leaders from southwestern Manitoba, in a Tim Hortons in Verdun. And Mayor Muirhead said, about that letter, we're still waiting for the doctor and we're still waiting for the emergency department. And I said, well, you know, our team has made a very ambitious commitment. We want to hire 100 physicians this year, 400 physicians over the next 5 years in Manitoba. And if we can't find a doctor for Carberry, I don't know how we're going to hit those other targets as well, too. And Mayor Muirhead, to his credit, you know, didn't pile on, but he gave me one of these. He's like, yeah, that's what we're saying, kind of thing. But the acknowledgement that he made to the members of the Health Action Committee and to some of the folks who work in our provincial team, I think it deserves all of us to really single that out and really reinforce that. We have seen firsthand now in the efforts to reopen your emergency department just how much effort and how much work comes from the grassroots. And it really is heartwarming and awe-inspiring to see those local efforts. So today we're making an announcement, but this is your announcement. This is the people of Carberry's announcement. You own this. And so we're here to say that yes, as a culmination of grassroots effort, strong local leadership, support from the provincial government, we're able to bring in a rotation of 3 physicians to Carberry who are going to ensure that there's an emergency department here for you should you need it. And also at the same time that they'll be able to visit in the personal care setting and deliver care for seniors here in Carberry. And you'll be able to make appointments too if you want to get into a primary care visit with the physicians while they're here. So there's going to be a whole range of healthcare services here to meet your needs. And it's a combination of these local efforts, the provincial resources, but also I think some really good problem solving and innovative thinking from the clinical side. And the physicians who are stepping up to say, you know what, we can work together and put together a model that works to meet the needs of the people of Carberry. And as your premier, a job that I feel so humble and awe-induced to be able to serve in the capacity of, I just want to say this. The experience of bringing an emergency department back to Carberry has taught our team so many lessons. And this is going to help us serve communities across rural Manitoba. The lessons that we've learned in Carberry are going to help us across Prairie Mountain, are going to help us across Westman, Central Plains, all of Manitoba. So many communities are up against it when it comes to the challenge of keeping the healthcare services in your community so that your community can stay strong. And so I really hope that the people here in Carberry feel a sense of pride that your contribution, your efforts, your tireless advocacy is not only bringing healthcare services back in your home community, but it's going to help ensure that there's strong healthcare services for many other communities and so many more people across this great province. And so yeah, I just really commend folks for not losing hope, for not giving up the fight and continuing to demand that thing that I think we all deserve, and that is a fundamental Canadian value, and that's good access to public health care. So thank you so much for joining us here today, and thank you so much to the people of Carberry, the Health Action Committee, your local leadership for leading the way. This is an announcement that we're very, very happy to share with you, and the fact that it's community-led just makes it such a good news story. So miigwech, merci, and thank you very much. Thank you. Absolutely.
Thanks a lot. Thank you very much for that, Premier Kinew. I can honestly say we're all very appreciative on this. Next, we would like to have Minister Asagwara speak.
Sure. Thank you so much, Mayor. Thank you very much. What a great day. What a great day. It's an exciting day for Carberry, as the Premier said. It's an exciting day for rural Manitoba because this really does set a good path forward for how we work together to make sure that we are strengthening healthcare across rural Manitoba. I've had the chance to meet a few of the physicians who have signed up to work in this centre, and I can already tell that this community is in good hands with people who are dedicated to providing quality care in rural settings. I had the chance to walk through the centre here on the way out, and your nurses rock. Just awesome. Just the best folks. Happy National Nurses Week to all of you. Thank you. Yeah. You know, having these doctors here in Carberry is a game changer. And it not only means that the emergency department is going to open up again, but it means that seniors who live in long-term care facility, long-term care home here will benefit from physician care alongside the dedicated nurse practitioners who have been providing that care. Yeah. I really want to acknowledge the nurse practitioners who have just been doing so much heavy lifting and whose voices have helped inform the approach moving forward, who are invaluable to this community. I want to acknowledge all of their service and thank them for being a part of how we've gotten here today. Yes. This is all going to help the overall health of the community. Folks will be able to book appointments with doctors for non-emergent issues. Being able to book these appointments is really significant because it means that this community is going to be able to access timely primary care. Primary care is so important, and that is why it is such a big area of focus for our government. It's why we're investing in strengthening primary care across rural Manitoba and across the province. It's in the Premier's mandate letter to me. And you might want to take a minute and read that mandate letter. It's very long. It might take you a little while. No shade to the Premier. It's very long. But primary care is a big part of that mandate letter and the Premier's mandate to myself and, quite frankly, our entire team. And it's important that it's in there because we know that having access to primary care directly impacts the outcomes for people and their communities. It's key for our long-term vision for healthcare in Manitoba, one that sees the overall health of Manitobans improve with the pressures on our hospitals and emergency departments decrease. It's something that we know is going to take us time, but today is a step, an important step in the right direction. And it all starts with having more access to family physicians in communities just like yours. The work that we need to do across the province is being exemplified here in Carberry today. We know that your community and many other rural communities suffered under the previous government's cuts. We know that the previous government's cuts to healthcare and what happened in Carberry also happened in many other communities across the province. And it's difficult when I talk to folks across rural Manitoba who tell me that they felt like the previous government had turned their backs on rural Manitobans, had turned their backs on rural healthcare. That when physicians' contracts expired, the previous government didn't reach out to help. Letting emergency departments shut down, letting emergency departments go without the services that they should be providing, letting doctors and nurses fade away from communities that count on them was unacceptable. And we know that there's been a lot of damage done that you folks and others have had to endure. And we also know that it's going to take us years to repair that damage. But today is the example of what can be achieved by working together. That is what today is about. It's about what we can do when we work together, by working with other physicians, by working with community, your Health Action Committee, working with regional health authorities, Prairie Mountain Health. We know that by working together, rural healthcare will get better. Doctors can be recruited. It takes a little bit of work, a little elbow grease, some dedicated community folks like Loretta, who will give you hugs and let you know that it's okay. It's heavy lifting, but it's okay. But we know that it's possible. And it's important for you all to know that our government is here to help. It's important for the nurses, nurse practitioners. We've been saying help is on the way. Well, today is a good example that help is here. And we're going to keep making sure that we deliver on that. You know, lastly, I want to say thank you. I want to say thank you. You know, there's a lot of work that we're doing to bring more resources out to rural Manitoba, whether it's expanding the provincial nurse float pool or investing in rural paramedicine. But first and foremost, I just want to say a deep, deep thank you. It has been an absolute honor to work with your community, with your leadership, to work together to bring back healthcare to you folks. And I look forward to doing this work together moving forward to benefit other rural Manitobans. And I know that you folks are dedicated to not only improving healthcare right here in Carberry, but across the province. So thanks for everything. It's an exciting day. Celebrate, enjoy, and let's keep the conversation and the work going together, folks. Thank you.
Thank you, Minister Asagwara. Now I would like to introduce my colleague, Councillor Mike Sudak, to step up and say a few words. Mike?
Okay, good afternoon, everybody. I don't really have anything written out because I was waiting for the announcement to see what was going on. But a while ago, we had a problem, you know, with the staffing with our hospital. We heard there was going to be a problem, and we heard there was going to be hours cut and then potentially maybe it closing. And at that time, we reached out to all different parts of government, and the first person to come and speak to us was the Premier here, well, before his election. Then he had I had the chance to come, and he listened to us, and he felt our pain and maybe seeing the hospital or the ER closing and our clinic losing doctors. At that time, he invited me to Verdun to speak on a story about when my wife swallowed a wasp, and we had to rush to Brandon because there was no ambulance. The ambulance was out of town, the ER was closed. And he told me that story hit hard with him and with other Manitobans around that we're losing our health care. And as you heard him before, he made a promise to us that he'd bring doctors back. And he did. He brought doctors back. But not only did he bring doctors back, but our community and their countless hours, and it was all volunteer work, all in their own time, the Health Action Committee, everybody working so hard to push. And they did it. For myself, and I know from everybody standing here from Carberry and the North Cypress Langford area, we have a sense of weight lifted off our shoulders now. Now when our children get hurt or our elderly get sick or we need something, it's here. It's here now. You know, next month I heard that we're going to have our full complement of paramedics as well. So not only do we have our doctors, but we have our paramedics, right? So the government's coming through and they're keeping their promises. And that hits home with me, that when someone makes a promise, they keep it. And our community tirelessly poke to get this done, and they did it. So I just want to thank everybody from the Health Action Committee, councils, the community, and especially the government. Thank you very much for opening our hospital back up and having doctors back. Thank you. Thank you.
Thank you, Mike. Well said. You took the words out of my mouth. Thank you very much.
Sorry.
Now I'd like to invite our final guest speaker, Loretta Oliver, to say a few words. Loretta.
I have notes. As mentioned, I am a member of the Local Health Action Committee, one of many strong voices. I believe I was described as a strong voice for Carberry's healthcare. I am a member of this community, an amazing community. A community built on agriculture and industry. We have a large seniors population, 2 active schools, sports facilities, and churches. We are close to one of Manitoba's most beautiful provincial parks and the Sandhills Casino. The municipality of North Cypress Langford is home to 5 Hutterite communities. We are situated on the Trans-Canada Highway. This is a very active community. The people of this community, residents, visitors, tourists, not unlike all Manitobans, need and deserve access to healthcare services. I am a grandma. I think that's how most of you know me. And I want the best for all our families. I arrived in Carberry, December of 1976, when I accepted a position, a 2-week position at the Carberry Hospital. Take note, I'm still here. This was a busy, thriving facility. The physicians, the nurses, and all allied health workers prided themselves in providing health care to the best of their ability. Locally, provincially, and even federally, we have sadly seen our healthcare system crumble. The journey that has brought us to today's announcement has not been easy, and in fact, it has been, at times, so very disheartening. This provincial government is genuinely trying to improve our healthcare system. Premier Kinew said he would help our community. And in fact, he has been absolutely amazing. Thank you, sir. Our health minister and staff have been so very supportive. Today's announcement is the first major step in a positive direction. On March 27th, when we first met as a large group of stakeholders, the health minister and staff presented a plan. This was to be a multi-phase plan. This was the light at the end of the tunnel. I told the minister if this could happen, there would be a hug and homemade cookies. So excuse me.
Wow. Oh my God. Love you too. Thank you.
Thank you so much.
Oh my gosh. Oh, you're the best.
That's amazing.
Don't eat them all on the way home.
Thank you very much, Loretta.
There's 2 different kinds and they're gluten-free.
We'll figure it out.
Never made me any cookies, but anyway.
They're in my car.
Thank you very much, Loretta, all the speakers. That concludes our speakers. I guess we move on to questions from the media right now. If anybody has any, direct them to the appropriate person.
Sure.
Yes.
I'm Michelle from the Brandon Sun for you here in your head.
Okay.
How did all this happen? If you could take us through, was it the squeaky wheel and the grease, or what advice have you got for other municipalities?
When I was elected mayor, this problem didn't just happen overnight. This has been years in the making. So when I was elected mayor, I was along the same lines as a provincial government. I had health care was my top mandate. And the very first meeting I had was with the representative CEO from Prairie Mountain Health. And yes, it was the squeaky wheel. That's how you get yourself on the map. I'm not saying we're any better or any worse than any other community out there, but you have to get your name out there. And we were the squeaky wheel. We made it happen. We met with Premier Kinew, with then opposition leader Kinew, with the minister, with other several dignitaries. Partway through the process, I met with Dr. Maharaj, and he's been very instrumental in helping us. And And it just, it led up to where we are. We tend to take things for granted when we're a community, especially Carberry. We were always used to having a doctor here. It was just a given. And when we lost our last doctor back in September, I mean, thank God for our nurse practitioners and our nursing staff, but I mean, we were in panic mode. So we really went to town as a council, as a health action committee, as members of the community to try to make this happen. We wanted our voices to be heard, and it's evident today that they were heard. So it's just for any other community out there, just keep that message going. And it doesn't stop here at this announcement. Like this is going to be a continuing effort. Future councils, future governments, it's not the same as what it used to be. So we have to really work at this and continue the momentum going forward. Thanks.
Oh, I get the first try? Sure, yeah. Sure, if you don't mind. Yeah, thanks.
Keep your hands out.
Yes.
What is the plan? Is there a blueprint for other communities? What should they do?
Well, I want to follow up on what the mayor just said because it's very important. The work is ongoing. We want to make sure that we continue to work with physicians, with nurse practitioners, with the Health Action Committee and the region to make sure that we're continuing to staff up in Carberry and make sure that we have a long-term sustainable plan. And, every community has its own uniqueness, and that's why it's so important. And I really appreciate what the mayor just said, to build relationships. So there is a bit of maybe a template in terms of an all hands on deck approach in order to get here today in Carberry. And our commitment has been that we will work with everybody as a government who wants to work at improving healthcare and fixing healthcare in rural Manitoba. And so building relationships is key, working together, bringing people to the table, listening to frontline voices, listening to community voices, valuing them in how we develop plans for rural healthcare is fundamentally the approach that our government will continue to take. And how strengthening services looks in every community will be unique to that community.
So is there an actual blueprint that Melita, Grandview, and even Roblin can say, yeah, can you just fax it to us?
Oh, that's I fax. Yeah, we're trying to move away from faxing in healthcare. Yeah, but I take your point, and what I would say is, we've stood up a recruitment and retention office as government, which hasn't been done before, to make it easier for rural communities and for regional health authorities and grassroots action committees to have one central place where they can bring their concerns and ideas forward and work with our government to improve healthcare in their communities. And so the template is about relationships. It's about respecting frontline healthcare workers. It's about respecting what communities say their needs are. It's about working with physicians, not working against them like what we saw for previous years under the previous government, and creating an infrastructure as a government, which we've done with the Recruitment and Retention Office, that allows a central place for people to know they can work and partner with government to bring healthcare services to their communities.
If I may follow up on that point, one thing that has come up over the years has been a concern that every community has been trying to put money toward bringing doctors, bringing nurses, and one of the issues that has come up over the years and popped up is that we have communities essentially trying to outdo each other. Now, how do you get around that? Because even Brandon's trying to get on the action now, trying to put money toward trying to find more specialists, that kind of thing. How do you try and circumvent that?
What we've seen so far be really effective is when we work in collaboration. And that includes when communities work in collaboration. And so certainly making sure that we have an understanding of not only what's happening in Carberry, but what is happening in Verdon, what is happening in Brandon. How do we make sure that we're working collectively so that communities have the resources, staffing resources and services that they need? And it's fundamentally, and I keep saying this, it's rooted in relationship building. When you have a previous government approach that was cutting services and pushing away community, it kind of forced communities to think about their own individual needs and to protect what they had because they were understandably so concerned about their services being cut. And now, our message from day one has been about respect, about respecting communities, about working in partnership, respecting healthcare workers in rural communities, valuing their expertise, and working in collaboration, truly in collaboration. And so what I found in my role is that when you extend the invitation for people to come to the table, they're eager to do so. And the perspective is broadened in terms of not only, and you can hear it here today, not only what are we doing for Carberry, how are we strengthening healthcare in Carberry, people are already talking about how do we make sure that we're also strengthening healthcare in other rural communities too. How can Carberry help? And that's very Manitoban. That's a very Manitoban value, is not just about me, but it's about the we. And I think that that's wonderful, and that's a value that's important to our government. Reamer, did you want to add anything?
Do you then see the opening of maybe ER hub communities? Because there's 15, 20 communities that have closed their ERs over the past decade or longer. Do you envision sort of a scenario where certain communities are prioritized based on geography?
Every community is important. Every community is important primary care, access to emergent care, emergency care is important in every community. And, you know, today announcing that we are bringing doctors to Carberry, that we are able to reopen emergency services here. There's going to be enhanced primary care, enhanced care in long-term care, is something to really, really celebrate. And it's so important that we respect what the needs are of individual communities and understand them, and allow communities to lead what healthcare needs to look like in their communities. And so I can't speak to what models are going to happen or not happen in rural communities, because it needs to come from those communities themselves. And so I just look forward to the continuing work our government is doing to continue to build strong relationships with municipalities and leadership, with frontline healthcare workers, with community groups that have been advocating for so long and are finally at the table, to see, you know, how much good work we can get done together to strengthen rural healthcare.
I know you say that every community is important, but you also talk a lot about ambition, and opening up 15 rural ERs seems maybe another level above that in terms of ambition. Practically, though, are we looking at this? I mean, what's the practical next step? Some ERs have been closed for a decade.
I think the practical next step is to recognize that we have a responsibility as a government to be ambitious. That communities, that healthcare workers in rural communities have been ambitious, and it's long overdue they have a government that matches that ambition and that matches that level of commitment. And so again, you know, we're here in Carberry today to celebrate the efforts that this community has brought forward for a long time. And the commitment to collaboration that we've seen in Carberry, we are also seeing in other rural communities. And our commitment as a government is to work in collaboration, is to listen to the expertise on the front lines, to listen to communities' needs, and to work with their leaders and with authorities, regional health authorities, to enhance care in rural Manitoba.
Sounds like Carberry is getting more paramedics.
Yeah.
What role does paramedics play in
Paramedics play an integral role to healthcare in rural Manitoba. You know, and I will reference previously, we saw in rural Manitoba for years that rural paramedics couldn't practice to their full scope. They couldn't be trained as advanced care paramedics and practice in rural Manitoba. They weren't being hired to practice in rural Manitoba. And, you know, Carberry having an increased number of paramedics reflects our government's commitment to making sure that healthcare in rural Manitoba, in Carberry and in other communities is enhanced, that you have the full scope of healthcare opportunity here in rural Manitoba. And so making sure that we are training paramedics in rural Manitoba, that we are allowing folks to train up to be advanced care paramedics and to practice to their full scope is fundamental to having strong emergency response services across rural Manitoba. You know, you heard Mike's story, a bit about his story and what he and his family went through personally, not having access to emergency services in their own community. We're trying to right that wrong as a government by strengthening paramedicine, by investing in primary care, by investing in emergency departments, physicians, and staffing across the board, being in Carberry and across rural Manitoba. And we know that there's a lot of work to continue to be done, but we look forward to doing that in collaboration with our partners.
Can you elaborate a little bit on that? Was reference here in a couple of weeks we see the paramedics being staffed here. Is that undermining a future announcement, or is there anything you can say?
We talk about it every day, all day. That I think it's wonderful to talk about as much as we possibly can that healthcare is improving in rural Manitoba. I think it's important. We talk a lot about the fact that we have been investing in training more paramedics. We've been investing in training more paramedics in rural Manitoba. We've invested in paramedics being able to access advanced care paramedicine training and being hired in rural Manitoba. We're making sure that paramedics have letters of offer to stay in Manitoba and practice. And so we're doing a lot of work in partnership with municipalities, in partnership with regional health authorities to make sure that paramedics have the opportunity to practice across rural Manitoba, which is something we didn't see for 7.5 years previously.
So I'm taking then that answer is not right now. We'll tell us in a couple of
Oh, we'll have lots. This is great news we're here sharing today about the ER and primary care in Carberry, Manitoba. There's more great news that we look forward to sharing in terms of paramedicine and other aspects of healthcare as well.
I do have a further question for
For sure.
I have my hands like this.
But I wanted to switch gears slightly. Obviously, you saw the story in press at CBC today about the banning of books at Clear Lake.
Oh, okay, yeah.
I was wondering if you could. Your minister didn't seem too in love with the idea and was hoping for an alternative. How do you feel about this situation?
Well, I'm like a lot of people in Manitoba. I know our summer, summer could be longer, and we want to make the most of the time that we have to enjoy it here in Manitoba. So I'm disappointed that the federal government has let the situation at Clear Lake get to this point. Where was the action last summer? Where were the actions in previous years to prevent zebra mussels from coming to Clear Lake? And so we got to do right by the lake and the environment. I think everybody gets that. But just the way it's been handled with a closure and not a lot of conversation or consultation, I don't think was the best approach. So I know that what it also means for us as a provincial government, those boats are going to go somewhere, right? And so I think it's going to be incumbent on us. We've added more money this year in terms of inspections and cleaning for boats and watercraft. It's going to be important for us to be there at Oak Lake, Lake of the Prairies, at other destinations for Manitobans to enjoy summer, to make sure that we're getting ahead of this issue and not letting it spread. So there's a requirement for us to act as a province, even as we're trying to encourage the federal government to step up in their way.
Is there any chance that the province might follow the provincial lead or the federal lead in this and close access to other lakes that might be in danger?
We're not looking at that.
No.
Yeah.
What would be the alternatives?
Well, I think first and foremost, when it comes to zebra mussels, you want to talk prevention, right? And so that's where our focus is. We increased the budget for this. It's about $500,000 investment this summer for the inspection stations for watercraft and cleaning, and we've been accelerating that. When we heard the news about Clear Lake, we've accelerated that to put these into place. And again, Manitobans are going to enjoy summer, rightfully so. And so we're going to have to ensure that we respond to this federal government announcement by putting in those resources to ensure that there's good supports for some of these other summer destinations.
What happens to the businesses in like in the Saugatuck and some of the areas around that would have been, will likely feel the effects of active boat traffic?
Yeah, like when my wife and I first started dating, she lived in Dauphin, and that's where we went for like a night out, right? As we went to Wasagaming and to Clear Lake and just hang out, and so many Manitobans do that as their summer plans, and so there is going to be some form of impact. We don't know yet what that's going to be. I think it's incumbent on the federal government, having taken this decision, to step up and help make these business owners and other folks that are going to be affected whole. And so as a provincial administration, like, we're going to be there for Manitobans. And I guess we're just going to have to keep working with folks. Like, our ministers were in the community, including Minister Simard, all right, talking to people. We've encouraged the federal government to step up and engage with people in the area to the same extent. So we're going to continue to be there, and we'll be just, I guess, to mix metaphors here, riding that wave along with people in the region as well, and offering supports as needed.
The question I have is that Peace for Women has come out, at least they support trying to take the summer off, literally.
Yeah.
Yeah. Do you support their concerns?
Well, the voice of Indigenous communities in the region have weight, and they need to be taken into account. But the voice of the businesses also need to be taken into account. The voices of people using Clear Lake and other summer destinations across the region need to be taken into account. And so we're trying to take a balanced approach that is going to ensure that we look after the water and the environment, but also that we ensure that Manitobans can make the most of their summers, not just this year, but also for generations to come. Okay, I think we have some Zoom questions.
Yes, thank you, Premier. Two reporters on the line. Up first from Canadian Press, Steve Lambert. One question, one follow-up. Steve?
Oh, thank you. Just looking for some details on the Carberry announcement. With 3 doctors in rotation, what are the hours for the emergency department? Is it 24/7?
We can follow up with a lot of specific details, but basically the emergency department service is comparable to what was here before the closure. And so this 3 doctor rotation involves physicians coming from Brandon and Verdon to staff up this facility and reopen an essential healthcare service for people who live in Carberry and the region.
And as you mentioned previously, there's also a challenge in terms of retention of other healthcare professionals, recruitment and retention. Are there enough other health professionals, nurses and the like, to run the ER?
Well, I want to reiterate our health minister's thank you to nurses this National Nursing Week. Thank you to Allied Health. Thank you to the healthcare aides, to the volunteers and the support staff who make a facility like this work each and every day. This is a comprehensive approach that's needed, and I really want to reaffirm what Mayor Muirhead said about this being an ongoing effort. Part of what led to the situation that called on us to take action was a lack of succession planning or planning for people to take time off, or what do you do when somebody retires? And so we're going to have to stay up to the minute in terms of ensuring that the staffing is maintained here over the long term. And also, as we continue to add the healthcare offer here in the region, there's going to be a requirement for continued investment. And so this is going to be not just a press conference from your government today. This is an ongoing commitment to the people of Carberry and to the people in the region about healthcare. And if I could take a second just to reflect on some of the other questions that were posed earlier, we need to show flexibility with rural healthcare. Question was posed about Melita. I think we know the Banana Belt is not the same as the sand hills of the Spirit Sands Desert. And so we have to be flexible as a government. We bring the resources forward, we bring the investments, we bring the horsepower to help troubleshoot and problem solve. But the reality is that it's not enough for us as a government to just pass a budget and then assume that everything's going to be fine. One thing that we've learned through this experience is that we have to show up and put in the same level of effort as the local leadership and volunteers, because it is about tailoring specific solutions to match the needs of a given community. And when we do that, that's how we're going to have a healthcare system that works to meet the needs of the average Manitoban. And so we're going to have to continue to display this targeted and tailored and flexible approach, because at the end of the day, we want healthcare for everybody in Manitoba. And we have been challenged with a bunch of things, whether it's COVID or the cuts of the past or the nationwide healthcare recruitment effort that we're competing with other provinces with. The way that Manitoba succeeds in that landscape is by us sending a message to the healthcare front lines that we're there for you, that we're going to be making the investments, and then we say this is a beautiful place to live and work. If that's the conversation, I'm confident that we can be a winner in that conversation. And so again, at the risk of mixing metaphors with the Clear Lake conversation, when you think about our healthcare system, often people relate it to a boat, right? And it's difficult to turn a large boat like our healthcare system overnight. It has to be an ongoing, continuous commitment if you want to get to a positive destination. By the same measure, if your boat's taking on water, first thing with healthcare, we have no choice. We cannot abandon ship. It's too important. We have to save this ship. And so how do we do that if it's taken on water, as it had been for the past 2 terms of government? Well, before you bilge, before you start bailing water, plug the hole in the bottom of the boat. And right now, that's about the staff. That's about the people who are caring for the patients. That's about the nurses, the doctors, the allied health, the healthcare aides. They've been crying for help. And over and above saying that we're here to re-announce the reopening of the emergency room for Carberry, we're here to say to the front lines that help is coming and help us here. So thank you so much for everything you do for us on a day-to-day basis, and we're going to keep showing up to support you.
Thank you, Premier. Our last reporter is Chris Kitching from the Winnipeg Free Press. Chris, go ahead. Oh, I'm trying to unmute you, Chris. One standby.
The magic of Zoom.
Yeah, we're having trouble unmuting Chris. Can you hear me now, Chris?
Hi, am I?
There we go.
Can you hear me now?
Yeah, we
Yep.
can hear you.
Okay, perfect. Hi, good morning. My
Morning.
questions are for Minister Asagwara. They relate to long-term care homes. Just in speaking with people at nonprofit care homes, they voiced some concerns about deficits and struggling to keep up with aging infrastructure. So will the province change the funding formula for long-term care homes so that it is indexed to inflation?
Our government is committed to investing in strengthening personal care home capacity. We're investing in making sure that we are adding staffing capacity to the front lines of healthcare, and that includes long-term care homes. In terms of the funding models for personal care homes, we've had great conversations with long-term care representatives and long-term care homes across the province in terms of what their needs are. And this budget does make significant investments in long-term care, but certainly our eyes are always to how we can improve and how we can work with long-term care operators and providers to improve the care that seniors and those who are living in long-term care homes receive.
And one last one for you. What more will the province do to address those issues with aging infrastructure to help, provide the funds for upgrades or improvements at these homes?
Our government has been very clear that we're committed to improving and increasing the number of personal care home beds across the province. We were in Lac du Bonny not that long ago announcing that we're going to build that personal care home in that community, and they've been advocating for decades actually for that to be realized. And we're going to continue to add beds to our province in terms of personal care homes. It's true that there's aging infrastructure in terms of not only long-term care homes, but other aspects of the healthcare system. And we are constantly assessing and reviewing what that infrastructure looks like and the opportunities to invest to improve long-term care infrastructure, whether it's new personal care homes or supporting the existing as well. It's important to note that the previous government did not have a plan of any kind in place at all when it comes to long-term care. And so I'm committed as the minister to working with long-term care home operators, to listening to residents who live in long-term care and their families, to make investments that not only add beds, but improve the quality of care that long-term care residents are receiving.
That concludes the questions on Zoom. We'll turn it back to Carberry.
I believe we might have one of the new doctors in the crowd.
I was going to introduce them.
Yeah.
Yes, it's not on my agenda today, but I want to take the time to introduce you to a couple of doctors that are helping us out, and we're very much appreciative of it. Dr. Iliorani, Dr. Fashola. They've been helping us out with our ER and continue, and we're very much appreciated.
My question for either of them or both of them, why Carberry, how often will you be here over a week? You could just touch
Sure,
the
yeah.
microphone, and also if you could spell your first and last name.
Sure. So first name Clevis, last name Iliriani, Klevis, Iliriani. So I was pretty impressed how committed the community was to attracting a physician here. They seem to have a very attractive plan. Everybody was super committed, so I really appreciated that. So that's one of the reasons why I came here. And I want to give special thanks to Dr. Maharaj and Barry Bannock as well, who reached out to me. They told me about this community, and I was certainly impressed by the plan. So yeah. Okay, thank you.
Hello, I'm Dr. Zahid Fashola. Zahid is Z-A-H-E-E-D, and Fashola is F-A-S-H-O-L-A. Why Carberry? Well, I like to be on the positive side of things. I like to help, and that's why I'm a physician. So when I was called on to serve, I feel the least I could do is to help. I want to see Carberry succeed the way Verdun is succeeding. So I wish everybody the best of luck.
might add that Dr. Iliran travels here from Ottawa, so Carberry's a great place to live. You know, we can hook you up. So. If there are no more questions, I guess that's it. Oh. Yeah. Okay. Okay. All right.
It's gonna keep.
Okay, so I thought you would never ask. But, question that's on everybody's mind. So delicious. Amazing texture.
Gluten-free.
Gluten-free.
Absolutely.
I don't believe it.
They are.
They're so good. I'll be back.
Department evacuation in the city of Winnipeg yesterday. People had 12 hours to leave. Your reaction to that, and is there a role for the province?
There is an important role for the province. So first of all, I just want to say I can only imagine how stressful this is, where you're coming home from work or you're bringing the kids home after school and all of a sudden you find out you have to move. And your lease has been terminated and your building has been ordered to have a mandatory evacuation. So, you know, my heart is really with the folks who are put into this situation. And anytime the Manitobans are struggling and, you know, in a situation like this through no fault of their own, like, we have to be there. The city is leading this response. That's the nature of the structure of how this thing plays out. And so the city has set up their reception center. You know, we travel past the site today. There's tons of activity there. I know that the people from fire and the Winnipeg Police Service are going to be going door to door and ensuring that the mandatory evacuation gets implemented. But our government is in there as a supporting capacity right now, and will be there for the long term. So what that means in the immediate instance is the city of Winnipeg is there to ensure that folks have a place to stay, have the immediate next steps taken care of. And we're assisting with that effort specifically around healthcare. And so if folks don't have medications, they have mobility issues, you know, maybe the health card got lost in the rush to pack up, we're there to ensure with shared health staff and government staff to ensure that folks are not going to miss anything by way of important health services, whether those are in community at home services or needing transportation to a clinic or anything like that. And then over the longer term, unfortunately, we do expect that this is going to play out over a weeks and months timeline as opposed to just hours and days. And so as Manitobans who were forced into this situation because of the issues with the building need help, we are going to be there. And what that looks like is going to depend on the nature of the assistance that people require. But if we can offer any reassurance to people today who are already in a very helpful situation, if we can offer any reassurance to people today who are already in a very stressful situation, it is that we are going to be there to help. And we're going to be there to make sure that you get what you need through this difficult period. And I can say that there's a lot of good-hearted Manitobans here today who know exactly what we're talking about. People step up to help one another in times like this, and your government's going to be there too.
And on the subject of the intersection, did Carberry how far along is the province in terms of consultations and in terms of picking the right intersection choice?
Well, we're still in that consultation period, and again, this is a process of hearing from folks in the region who are going to be using this intersection the most, along with other users of the highway, including the ag industry, the trucking industry. This is going to be a process that puts safety first. And as we heard from the engineers, there's a few options to make the intersection safer. So now we also need to get the perspective of community and industry to figure out, of those safest options, which are the ones that are going to work day in, day out. And so our commitment is there to ensure that we're making the investments along the Trans-Canada to ensure that there's safety, first and foremost, for people in Carberry, the region, across Manitoba and across Canada. And then on the level of just acknowledging what happened last summer, first of all, to the first responders, like, thank you so much. And we cannot ever thank you enough. So please share with your peers, how much we appreciate, and we never wish that anyone would have to see what you saw on that day. But what we can do is ensure that we're going to have your back by way of good healthcare services and emergency services here in the community. We're going to make the intersection safer, and we're going to commemorate what happened. So we're contributing to the memorial along with community and other folks, and I believe June 15th is when that memorial in Dauphin is going to be unveiled. So again, a very difficult period, but we'll get through it the way Manitobans always do, by getting through it together. All right. Alors, juste pour ajouter en français, nous sommes ici pour annoncer une ouverture de la salle d'urgence ici à Carberry. C'est une initiative qui a été appuyée par les bénévoles ici dans la communauté, par les leaders de la communauté, par votre gouvernement, mais surtout par le peuple de Carberry. Alors, c'est une bonne annonce et nous sommes très contents d'être ici. Merci beaucoup. Thanks, everybody.
I guess that concludes, just to follow up to what you were saying about the accident at the highway. The town of Carberry is meeting with representatives from Dauphin next week to discuss a memorial set up here in the town and up there. So that's where we're at on that. Monday we're going to be meeting with them. I think Dauphin's getting memorial, and I think Carberry's going to get one too. So we're going to meet with them next week to discuss all the intricacies of that. So if there's no more questions, I would like to thank everybody for coming out. This is a great show of support. Thank you very much. And also I would like to thank everybody up here for all their help. It took